This video is going to be very useful for exam-going candidates who are struggling with time management. Many of my students struggle to finish history taking in MRCP PACES within 6 minutes. Are you also one of them? Don't worry. By the end of this video, you will know a simple framework to nail it every time. Divide these 6 minutes into 3 clear steps so that you can easily remember. Step number 1. The golden first minute. Start your history with greeting, introduction, check identity, set agenda, and one open question. Like you can ask, can you please tell me in your own words what brought you to the clinic today? An important tip here, let the patient speak. Don't interrupt and pick up the key points and important clues. In the exam, patient or surrogate wants to help you actually. Then step number 2, the focused 4 minutes. Ask the key questions leading towards your diagnosis and use mnemonics, for example, OD-PARA, which stands for onset of symptom, duration, progression, aggravating and relieving factors, and associations. And if presenting complaint is pain, you can use the mnemonic LOKIRA or Socrates. LOKIRA stands for location of pain, onset, quality of pain, intensity, radiation, relieving and aggravating factors, and associations. Another mnemonic is PACES 5-box model, which include 5 points: past medical history, drug history, sexual and social history, family history, and ICE, that is ideas, concerns, and expectations. Important point is do not miss any part. After digging out your presenting complaint, ask the specific questions of the system involved and do not miss general constitutional symptoms. Step number 3, the last 1 minute. Complete any remaining part of your history and do not ask everything, just what's relevant according to your history and case. Let's do a case. Suppose patient name is Mr. Zia, age 50 years old, and the presenting complaint is chest pain. So how will you go? Good morning, my name is Dr. Iqbal. I am one of the doctors in the clinic today. Am I speaking to Mr. Zia, 50 years old? Nice to meet you. So I am here to take your history, do your examination, and in the end, I will try to answer all of your concerns. Is that okay with you? Meanwhile, I will write few notes, but let me tell you they will be kept confidential. Okay, so please tell me what brought you to the clinic today. Whatever the patient say, listen carefully, and when he stops, show some empathy like, I'm so sorry you are going through this. We will try to sort it out and help you accordingly. Where exactly do you have the chest pain? Since how long? How it started, suddenly or gradually? Is it getting worse or the same since start? What type of pain it is? Dull, sharp, stabbing or throbbing? What is the intensity of pain? If I ask you to score the pain from 1 to 10, 1 being minimum pain and 10 is the most severe, what is your pain score? Does the pain go anywhere in your arms, neck, jaw or back? What makes it worse? Does taking deep breath in makes it worse? What makes it better? Is it continuous or comes and goes? Is it for the first time or occur before as well? Is it associated with excessive sweating? Any feeling of being sick or throwing up? Any racing and pacing of heart? Any shortness of breath? Any shortness of breath on lying flat? Any nighttime awakening because of shortness of breath? Any swelling of feet? Any cough? Any noisy chest or whistling sound in breathing? Any fever or raised body temperature? Any fatigue? Any skin rash? Any lumps and bumps anywhere in your body? Any joint pain? Any weather preference? Any past medical condition you have? Increased blood sugar level or increased blood pressure? Any hospitalization before ever? Any surgery or procedure done in the past? Any allergies to food, vaccine or any medicine? Any regular medication you are taking? Any over-the-counter medication? Any change in the dose of your regular medicine? Any similar condition in family? Any disease which runs in the family? Any history of sudden death due to heart condition in family? Now I want to ask certain personal questions, but let me tell you they will be confidential. Do you smoke? If no, have you ever smoked? If no, does anybody else in home smokes? Passive smoking. Do you drink alcohol? Any illicit drugs ever used? What do you do for a living? Does these symptoms affect your daily activities? I'm so sorry for that. Do you drive? Any travel history significant before the onset of these symptoms? That's all about history. I mean, you have to ask short questions, and in this way, you will be able to answer. So here I have asked the history questions in only 3 minutes. But in exam the patient will answer obviously, but the whole process can be completed in 6 minutes. One more tip here, any point which is positive in the history, explore a bit, then move to the next question. And history should be focused and modified according to your case. Like for example, here I ask about smoking, active smoking, ex-smoking as well as passive smoking because patient has chest pain, likely cardiac or respiratory case. Similarly, the question of sudden cardiac death in the family, this you will ask if your case is cardiology. No need to ask any other in any other case, like for example neuro or GIT. So the take home message is your history should be focused and structures so that examiner also doesn't get bored. I hope that this video will be helpful for you. If you like it, please give it a thumbs up, share it with your PACES study group, friends and colleagues. And do not forget to subscribe to my channel for more high yield MRCP exam tips and other important content and information. Thank you so much for watching. Stay blessed. Allah Hafiz.